Hi, I'm Dr. John Hovanesian. In this video, we'll talk about what you can expect before and during eye surgery. We encourage you also to watch our separate video on what to expect after surgery, which includes what limitations in your activity you should observe and what rare early warning signs of trouble you should report to us right away. There's a lot of information here, so you may want to take notes and you may want to watch this video more than once. 1 or more weeks before some surgeries, like cataract surgery, you may have a pre-operative visit to our office where we'll perform measurements on your eye. If you wear soft contact lenses, please take them out at least 7 days before these measurements. For gas permeable or hard contacts, please leave them out for at least 14 days before measurements. You can put them back in after the measurements and wear them anytime up till about 24 hours before surgery. 2 or 3 days before surgery, one of our staff will also be calling you to let you know exactly what time to be at the surgery center on the day of your procedure. That call is also a perfect time to ask any last-minute questions you may have. We recommend watching this video again around that time so all this information will be fresh in your mind. For some procedures, we recommend starting eye drops a few days before surgery, so be sure to fill your prescriptions in advance. Check your preoperative instructions to see if your procedure requires drops before surgery. Even if you're experienced in taking eye drops, we also recommend watching our 3-minute video on our website on how to take eye drops. You're sure to learn some tips that you'll use. If you normally take glaucoma drops, you can continue these as well before surgery and right up to and including the day of surgery. You'll also continue these afterwards without interruption. If you take blood thinners, for cataract surgery, it's not necessary to stop taking them. But with other procedures like eyelid surgery, our doctors may sometimes make specific recommendations. Please see your preoperative instruction pages to find out what you should do for your procedure. If you wear any type of contact lenses, please leave them out at least 24 hours before surgery. On the morning of surgery, don't eat anything for 6 hours before your procedure and don't drink anything for 4 hours before surgery. You can take your usual medicines with small sips of water, except diabetic medications and water pills or diuretics. With those medications, please bring the medications with you to take after your surgery. Please leave all jewelry and other valuables at home and don't wear any makeup on the day of surgery. Please wear comfortable clothing. A short-sleeved shirt that's buttoned down or is otherwise loose makes it easiest for our nurses to monitor your heart and blood pressure during your procedure. We perform most of our procedures in our state-of-the-art Medicare-certified surgery center rather than a hospital. You should plan on being there for a total of about 1.5 or 2 hours. When you arrive, our nurses will help you onto a gurney and you'll be wearing your own clothing throughout the procedure. We'll give you an IV with medicine to really relax your nerves, and the nurses will put in a number of different eye drops to prepare your eyes for surgery. You may or may not fall asleep, but we'll be absolutely sure that you're comfortable and not nervous as you move into the procedure room. Most eye procedures take less than 20 minutes and they're painless. If you are awake, you may see a bright but not uncomfortable light. Many people see moving colors like a kaleidoscope, and you may be awake enough to talk with us to tell us how you're doing. If you're nervous or uncomfortable, we want you to tell us so, and we'll make you comfortable. Otherwise, it's best to remain quiet and relax. After the procedure, you'll be on your way to our recovery area and we'll slowly help you up. And shortly after that, we'll help you to your car and you'll be on your way home with the person driving you. Everyone who's having surgery needs a driver to get home. The best choice is usually a friend or relative. Unfortunately, taxis can't be allowed for transportation home. If you need help finding a ride, let your surgical counselor know. We hope this information is useful to you as you prepare for surgery. To learn what you should and shouldn't do after eye surgery, please watch our next video on this topic. Meanwhile, if you have any questions, please feel free to ask our staff. I'm Dr. John Hovanesian. Thanks for watching.